We're going to call the business session to order. We do not have a quorum. However, we will go ahead and get started for the sake of time for those who are here to do their reports. So for the moment, we will skip the approval of minutes from April 13th, 2017, and move on to the second item, the de Beaumont, did I say that right? De Beaumont. That's why I needed that second shot at it. Foundation's City Health Initiative Award. Councilwoman Kennedy.
Thank you, Mayor Pro Tem. The presentation today by Dr. Archer, the Health Director of the Health Department, Scott Hall with the Chamber, and Dr. Sarah Morton Anderson with the Health Department will highlight a new award the city received for our health policy. And so we are excited to hear about what criteria were used in the selection process and what new initiatives and advances we're making in Kansas City that got acknowledged.
So I'll just introduce somebody that doesn't need any introductions, Scott Hall from the Chamber, to kind of lead off our presentation. Scott's been involved with this project from very early on the overall advisory board for this project. So I want to thank you, Scott.
Thank you, Dr. Archer. Thank you, Councilman Wagner, Councilwoman Kennedy, councilmen, councilwomen. Thank you all for having me here today. This really is a moment in time for the city to celebrate and do a bit of reflection, and that's really what I'm here to talk through just a bit. I am the Senior Vice President for Civic and Community Initiatives at the Greater Kansas City Chamber of Commerce, and as you all probably know, a part of the work I lead there is around a project called Healthy KC. And Healthy KC really is a region-wide initiative, not just focused on Kansas City, Missouri, but on the greater Kansas City metro area. But certainly we focus a lot of our work here in Kansas City, Missouri, and our ambition is to try and make greater Kansas City a destination for health and wellness. You can see our mission and our vision there. We have been at this work for about 4 years. For the first 2 years, we were pretty quiet in how we did it, and then we launched just about 2 years ago in April of 2015. And since then, we've had some profound success, and I want to just briefly touch on why it is the Chamber finds community health and wellness to be such an important issue. So you can see here in front of you, the slide that's been pulled up is a slide showing the performance of for-profit company stock for those corporations that have robust workplace wellness programs compared against other members of the S&P 500. And what you see here is a really profound difference between those organizations that really do treat health and wellness as a fundamental principle for their organization when compared to just standard companies that aren't doing those same robust offerings within the health and wellness space. Our general thought on this idea is companies that are promoting health among their employees are going to outperform those that don't. And this data backs that up. The same thing is true with communities. Communities that are promoting health among their residents, among their citizens, among their voters, are going to outperform economically those that do not. And that's why we've taken this project so seriously at the Chamber and why we're so proud of some of the success we've had. Some of that success has to do with tobacco cessation effort that has passed here in Kansas City, Missouri, as you all well know. And I just want to briefly touch on why that's so important to business. The average cost to a private employer every year for every smoker it employs is $5,816, according to a study done at the Ohio State University. And go ahead to the next slide, Sarah. You can see when we first came before this council with the Tobacco 21 initiative, we did not yet have any city in the metro that was Tobacco 21. And as of today, I'm happy to say we have almost 1.5 million people in our metro covered by Tobacco 21. And I want to thank this council for its leadership in being the first community in greater Kansas City to do that. You probably remember you beat the unified government of Wyandotte County KCK by about 3 hours. But you were the first, and you were certainly not the last. All of this work is buttressed by what we now are learning through our Resilient KC project, which examines trauma, its impact on our community, its impact on the workforce. And you can see here the ACE score metric, ACE standing for Adverse Childhood Experience, directly impacts employers, directly impacts community. And go ahead to the next slide. you will see when you estimate the amount of cost incurred by untreated adverse childhood experiences, you very quickly get into very, very large numbers. Numbers that are borne by business, but are also borne by city government. And all of this is the reason why we are taking such leadership in this space of making Kansas City a trauma-informed community. And we will be doing that in part at an event on May 13th at Arrowhead Stadium called the Resiliency Rally. I hope you all are able to join. We certainly will have a city presence there and are excited to be doing it. Go ahead. Today we're here to celebrate as well a designation from the DeBeaumont Foundation, as Councilman Wagner alluded to, recognizing Kansas City, Missouri specifically as one of the 40 largest cities in the country for its progressive public health policy. DeBeaumont Foundation reached out to our Chamber of Commerce about 2.5 years ago, indicating they were going to take on this city health project. They sat down with us and they asked us whether or not we'd be willing to partner, and we said we would. As a result of that partnership, I was a part of a team that of health experts from across the country that created a rubric of 9 measurements by which the 40 largest cities in our country would be measured for public health policy. The announcement came out this February that Kansas City, Missouri was awarded a bronze level designation. This is meaningful for a couple of reasons. You can see in this map, not every of those 40 cities received a designation. In fact, only 19 of the 40 largest cities in the country received a designation of any kind. And Kansas City, Missouri is only one of 2 cities in what you would generally call the Midwest to receive that designation. To put it bluntly, this is a great moment for the city of Kansas City, Missouri to be extremely proud of the progressive public health policy we have. Only Chicago outpaces us in this measurement as measured by the City Health and DeBeaumont Group. It's a big deal. This is a really great thing for our city. I'll let Dr. Archer reflect on some of this too, but we were surprised at the Chamber. I think DeBeaumont was a little bit surprised, pleasantly surprised. And part of the reason we got into the Healthy KC project, which is, as you all know, we have not, as a region, always been known as a destination for health and wellness. We're known for jazz, we're known for barbecue. Those are great things, but they're not always things that denote public health. But this designation, some of the other work we're doing in Healthy KC, some of the work that the health department is doing, and what's happening here in Kansas City, Missouri, what I think we're here to say, at least I'm here to say, is we're starting to see a bend in the curve. And if we can continue to bend that curve and then to change the trajectory for public health in Kansas City, Missouri, we will see economic benefit that we would not or will not if we don't do it. Dr. Archer?
Yeah, if we can back up just one slide there, just to show the peer cities. Out of these 40 largest cities, 28 of us are part of a Big Cities Health Coalition under our National Association of City and County Health Officials. So just as you all relate to the U.S. Conference of Mayors and the National League of Cities, et cetera, we're working with these groups to address a lot of these policies. Those 28 cities have 54 million people and actually a larger population than the 25 smallest states in this country. So moving us towards better policy for cities can have a huge impact compared to even the 25 smallest states. Let's move back then to that other slide. Yes. So these are the 9 category areas that met the criteria that the expert panel, including our chamber and Scott Hall's representation, selected. And you can see we received a gold on the clean indoor air and tobacco 21 and our alcohol sales. We received a bronze on the healthy food procurement and literally just moving our vending machines, I believe, from our 60% to 75% would be enough to take to silver. We'd have quite a bit more work to get to gold, And we have a representative here from the Heart Association that just shared an executive order from St. Louis City that we may want to look at, that we could strengthen that. Part of the challenge here that the de Beaumont Foundation is doing is they're going to come back and assess again in 2 to 3 years, probably add 2 or 3 more categories, but we have a chance to move up in our medal status by taking some of these challenges on. Complete streets, we have some resolutions on, but because resolutions aren't binding in the same way, it wasn't enough to actually get a level of medal, but we could be moving forward on that. And quality pre-K, obviously. To get a gold overall, you had to have 5 golds at least. To get a silver, you needed to have 5 gold or silver. And to get a bronze, you needed to have 4 more medals, which is the category that we were in. So I think with that, maybe pause for any questions on this, and then part of the kind of the cleaning batting cleanup, if I can get my tongue to work here, Sarah will talk a little bit about our county health rankings and how that ties into our 5-year business plan on life expectancy and those issues.
Any questions for Mr. Hall or Dr. Archer? I think go ahead and proceed. Move on to the counties.
Okay. Thank you. So the Robert Wood Johnson Foundation every year releases county health rankings. So I thought it'd be a good opportunity to come tell you how we're doing and how we've been doing historically. But it's a complicated story because it's a county health ranking, and we're a city in 4 counties, and our counties are very different from each other, which you will see here in the rankings, in the newest rankings. So the model for how they come up with this is really based on the research of what it means to have health. So you'll see that 40% of the entire score for health factors is actually based on social and economic factors. So they rank not only on how long people are living and their quality of life, those are the outcomes. They really focus on what we are doing as a county or as a city in 4 counties to produce environments which are healthy. And that is a function of health behaviors, clinical care, the social and economic determinants of health, and also the physical environment. And you'll see policies and programs are all leading up into that. So when you see these numbers, know that they're not based solely on what we see as outcomes, but what we do from a policy and program perspective. So there's good news and bad news in the newest release of the rankings. So Platte, Clay, and Cass County are some of the healthiest counties in the entire state. They rank first for Platte, third for Clay, and 6th for Cass, and that is based on outcomes. Health outcomes are 50% length of life, 50% quality of life. So looking good. When it comes to health environments, health factors, Platte and Clay also consistently doing very well. So 2nd and 4th. And throughout the last 5 years or so, those numbers have been pretty consistent. Jackson County struggles a little bit with health outcomes and health factors, but over time we have moved up. So actually between 2016 and 2017, we actually moved up quite significantly. So I'll remind you on these bar graphs, lower is better. So we're 61st out of, they rank 115 counties in the state because some counties they don't include and they don't count. So 115 is our total. So we're 61st out of 115 in Jackson County, and that's an improvement over the last few years. So that's the good news. And then there's some not so good news. So this is Jackson County Health Factors ratings. So we, back in the day, 2013, we were 81st. So we're doing better than we were in 2013. In the last iteration, we were 75th. But we were seeing some real progress there, and then the trend seems to be reversing. The trend, I use that word lightly because it's only 5 years of data. The health factors rankings have gotten, the methodology has changed a little bit, so they're actually including more things. But what we're really seeing driving this reversal is either an increase in in childhood obesity or a stagnation, depending on what difference in years we're looking at, physical activity, and the proportion of kids who are living in poverty. Our health outcomes increase is being driven by a decrease in preventable hospitalizations and an increase in life expectancy amongst like our most marginalized communities. So there's some good things that are happening, but for some reason, like these social and economic factors and health behaviors are we're really struggling. This is taking the 4 different parts of health factors, so you can see how these compare. So clinical care, which is only 10% of your score. We're doing phenomenal. Like we're 15th in the state on clinical care. We have a really robust health levy. We have a very good safety net system. And I think that we should be really proud of ourselves there. But if you compare that to how we're doing on health behaviors, we're 54th. We're 92nd in the state on social and economic factors. Things like high school graduation, things like violence prevention, all the stuff that's in our business plan, all the stuff that's feeding into our life expectancy work we're doing cross-departmentally is all located in that social factors bar. And then the physical environment, so that's going to be air quality. So obviously the cities are going to, like, St. Louis and Kansas City are going to struggle more with the physical environments because we have more people, more things. But this also includes things like commute times and commuting to work alone, and whether our neighborhoods are put together for kind of social cohesion and social trust. So there's more to it than just the pollution. But we're 113 out of 115, and that's not good, especially when you compare it to our clinical care, where we're doing really well. So that is just a high-level overview. We have more data. If your offices or your constituents want to know more about this, we're totally open to doing that analysis, but it's just a little high-level overview of what we're looking at. So
The power of these rankings are that we know that even if we had no physicians or nurses, we had no clinical services, whether it be in a hospital or outpatient or at the health department, that if we actually improve these other factors, we will increase life expectancy much more. The problem in general in this country is we're creating more illness and burden through these other issues that aren't being addressed, and actually the amount of the GDP that's now going to illness care is actually causing health problems by taking it from other activity and services that could better promote health. So this is a good rally cry for us to be, and that's why our community health improvement plan focuses on these other areas primarily, because that's where we can get, to use a business term, we are past our marginal rate of return on illness care in this country. We really need to prevent things.
Very good. Anything else, Mr. Hall?
I'd just like to say thank you to the council and a special thanks to the health department. Aaron Gabert is here with the Heart Association. This is a collective effort. We are only going to be able to drive regional health improvement within the city if we all come at this together. And the health department here in Kansas City, Missouri is among our most valued partners at the chamber as we do our work.
Very good. Aaron, you've come all this way. Is there anything you wish to add?
No, really just
Hit the microphone there, so the folks at home can hear you.
Sure, up here?
Yeah.
Yeah. So I don't necessarily have anything formal other than just to reiterate what's been already said today, and that, these are very important issues to the American Heart Association. We have these priorities across the country, and we feel really strongly they're backed by our scientific research, and we've seen the way this can impact a community. And it's exciting living in Kansas City. I often speak to my colleagues, and they are very envious of the support and the leadership we have from our chamber, from the city. And it's always something very proud to be the ones leading the way. And so I'm excited to see how we will continue to do that and continue to lead throughout the entire country. So
Very good. Thank you very much. I'll open it up to questions, if there are any questions from council. I'll let you finish up, too, as well.
Well, is it? Okay. All right. Well, I will just thank you guys for the presentation and the work that you do. As Aaron just mentioned, population health is a very important issue, and as cities focus on developing, they want to attract new people, and quality health is very important. And so to be acknowledged for our leadership on making sure that we are addressing those issues that impact quality of life is great. And so I thank you for your leadership, Dr. Archer, Scott, and Dr. Martin Anderson. A couple of things that were pointed out earlier in the slides about the criteria that were used in the selection process. One of them is something that the Chamber has brought focus on, which is quality pre-K. And that's something that, Scott, you have been involved with the Chamber.
Yeah.
Can you speak to that at all, or where we may be in that process and where the opportunities would be?
So, sure, I'd be happy to. The Missouri Preschool Project and its existence and the funds that it brings to pre-K in the greater Kansas City area is the reason why it received a bronze designation. But I think the Chamber recognizes, and as do many people in the early learning community, that we can do better. We can go from bronze to silver to gold. And it is, as you know, one of our big 5 ideas. We are working diligently locally, statewide, and even at the federal level to try and bring more resources to do it. And I think and hope that you'll see some partnerships that are forming now that become more public here in the not too distant future around specific ideas that can be brought to bear on that specific issue.
Good, thank you.
Yeah.
All right. Anyone else? All right. Well, thank you all very much. Keep up the good work, and let's go for, when do we get to go back for a gold attempt again? A couple of years?
3 years.
3 years? All right. Get to work. Thank you all very much.
Thank you.
Our next item on our agenda is a discussion of ordinances, resolutions, and communications on today's docket or for floor introduction. Does anyone have anything? I might just make a couple of quick recognitions. First of all, we're glad to see Councilwoman Laura back at 100%, or at least maybe 95.
About 95.
95. Well, we're glad that you're back and
Thank
hope
you,
you're
sir.
feeling well. And then also want to recognize Councilman Reed, who is in D.C. on our behalf in the National League of Cities, doing testimony in front of Congress. I don't know if there's anything you would like to say to that, Councilman, but
No, we spoke a little bit about it this morning in our T&I meeting at about 8 or 9 o'clock whenever we met this morning. But I will just reiterate those points of certainly there is a lot of partisan bickering that certainly has taken place in Washington, D.C. And if you had a chance to watch the testimony yesterday, you sort of knew which side of the aisle many of the questions were coming from. But we in our city know from back in 2009 all the way to today, with our increasing water bills that continue to skyrocket, to help do a lot of the unfunded mandates that the federal government continues to give us, is something that is a burden to many of our citizens. And it was a fruitful discussion, I believe. And I think that in the 2 hours of our sort of grilling by members of Congress, it showed that there may be some recognition that help eventually may come, or some relief from the federal government. And, you know, it was even pointed out several times that if Congress thinks it's a good idea, perhaps Congress should pay for the good idea.
I like that mantra.
Hopefully that happens.
I hope so, too.
But it was great to be there, of course, on behalf of Kansas City, and, of course, in my role as executive committee member for National League of Cities, and advocating for not only Kansas City, but cities and towns and villages across the entire country.
Very good. Well, thank you for that. Very much appreciate that.
Thank
you. Anything else? I do not believe we have any closed session, so we are adjourned.
Thank you.